Hi, I'm Dr. Lenore Coleman, President and founder of Healing Our Village and Executive Director of Total Lifestyle Change. Welcome to Diabetes, the Truth About It. Is your blood sugar under good control? Do you understand the effects of diabetes on your eyes and kidneys? Are you on the correct insulin injection? Are you having trouble controlling your weight? Are you following your physician's advice? It is critical that you're using your diabetes medicines correctly. Diabetes, the Truth About It, is here to help you. Check out HOV Health to learn everything you need to know to manage your diabetes and prevent complications. If you have diabetes, you need to be careful not to get low blood sugars known as hypoglycemia. Normal blood sugar is 60 to 100 milligrams per deciliter. Low blood glucose or hypoglycemia happens when your blood sugar is less than 70 milligrams per deciliter. Everyone with diabetes should be using a blood glucose meter at home to test their blood sugar during the week and when you think you're having a low blood sugar reaction. If you do not have a blood glucose meter, Healing Our Village has low-cost meters and strips available. The signs and symptoms of low blood sugar are as follows: feeling shaky, sweaty, having a headache, feeling hungry or tired, feeling confused or angry, having a fast heartbeat. If you're experiencing any of these symptoms, the way that you treat low blood sugars is by drinking a half a cup of orange juice or apple juice, 1 cup of skim milk, or eating 6 hard candies, not chocolate candy, eating 1 box of raisins, or drinking a half a cup of soda with sugar. After you take these fast sugar sources, follow with a slow sugar source, like a meat sandwich, and then test in 15 minutes. If your blood sugar is still less than 70 milligrams per deciliter, report this to your doctor and repeat the sequence. Be sure to tell your doctor if you are having frequent low blood sugar reactions. Thank you for watching Diabetes, the Truth About It. If you have diabetes, you need to know your numbers. A normal blood sugar is 60 to 100 milligrams per deciliter. If you have diabetes in the morning, we want your blood sugar to be 90 to 130 milligrams per deciliter. During the day, your blood sugar should not go higher than 140 to 160 milligrams per deciliter. You need to know your ABCs. A is for hemoglobin A1C, which should be less than 8% with a goal of 7 to 7.5% based upon your age. This test should be done every 3 months. B is for blood pressure, which should be 130 over 80. You should check your blood pressure 4 times per week at night. If you do not have a blood pressure cuff, call Healing Our Village so we can get you on our remote monitoring program. C is for low density cholesterol, which should be 70 to 100 milligrams per deciliter depending upon your cardiovascular risk score. It is important to know your numbers. Take control of your diabetes to prevent complications. Thank you for watching Diabetes, the Truth About It. Do you have diabetes and cannot figure out what to eat? A balanced diet will help you keep your blood glucose levels in check. Look around you. How many overweight and obese people do you see? We now have an estimated of 160 million Americans who are either obese or overweight. Nearly 75% of American men and more than 60% of American women are obese or overweight. Nearly 30% of boys and girls under age 20 are either obese or overweight. So ask yourself, what's going on? Well, I can tell you, it's fast food and the fact that we're not getting our daily exercise. We know that African Americans and Latinos have especially high numbers, mainly due to what they eat. For people with diabetes, healthy eating habits are especially important. The first step is to have your doctor refer you to a dietitian or a certified diabetes educator. Watch your portions. Eat small meals with lots of vegetables, small amounts of meat and poultry. Avoid cookies, candies, cakes, and other foods that are high in sugar. Try to drink at least 8 to 10 glasses of water per day. Try not to skip meals. Try to eat at least 2 to 3 meals a day and snacks. Never let your body get into what is called starvation mode. Try to eat your biggest meal for breakfast and lunch and have a small dinner. Consider having a soup or salad for dinner. Remember, it is still calories in, calories out. Men should eat about 1,800 to 2,000 calories per day. Women should eat about 1,200 to 1,500 calories per day. You need to start reading your food labels of everything you eat. Focus on the percentage of fat, sugar, and salt that is on the label. People with diabetes do not need to be on a special diet. Just think ahead and plan your meals with a little bit from all of the food groups. Thank you for watching Diabetes, the Truth About It. For more information on how to control your blood sugar, sign up for Village Club today and get your own personal diabetes coach. Go to www.hovhealth.com or call 800-788-0941. Remember, you too deserve to live a long and healthy life. Hi, thank you so much for watching Diabetes, the Truth About It. If you have any questions or comments, give us a call at 800-788-0941. If you'd like to see more videos on diabetes or other chronic diseases, go to hovhealth.com. Join us on Facebook and Instagram. We are also excited to announce our brand new mobile app called Step Up 90. It's for weight loss and diabetes prevention. Go to the website and try our 30-day free trial. If you have any questions, again, give us a call, 800-788-0941. Remember, knowledge is power. Hi, how's everybody out there doing? I am so glad to be here today. I'm glad that I was able to get up and get dressed and get in my car and come here to Jonesboro, Georgia, where we are doing for you today our Sugar Busters Diabetes Education Series. I'm Lenore Coleman, Dr. Lenore Coleman, President and Founder of Healing Our Village and the Executive Director of my nonprofit, Total Lifestyle Change. And we are here in Jonesboro, Georgia, in our film studio. For those of you who would like to have a show, for those of you who would like to reach out and do the kind of educational programming that I'm doing, you need to come on over and be part of our village. And we can help you to achieve some of your educational goals as an organization. Sugar Busters, as you may or may not know, is an ADCES certified program. That stands for the American Diabetes Diabetes Educators. It's a national organization that provides and certifies national programs across the country. We've been they used to be called AADE, the American Association of Diabetes Educators. And so now, we've been certified for 15 years, a long time. And we give our classes all over the country. So we have programs going on in DC and Maryland. We have programs that go on in Los Angeles. We have programs that go on here in Georgia. And so we are really happy for you to come on board and to start to learn more about diabetes, more about how to control your diabetes and prevent the long-term complications of diabetes. So it's a 7-part series. We're here every Saturday from 12 to 1 streaming. And if you have questions or concerns or anything like that, we have just stood up a brand new site called Village Club. And on that Village Club site, it's villageclub-global.com, villageclub-global.com. I'm telling you that because we now have a chat function. So if you have any questions about diabetes or other chronic diseases, especially about your medications, I encourage you to start going to our communication platform that we've just set up called villageclub-global.com. So this is the 7th segment of Sugar Busters. It's a 7-part series, so this goes over 7 weeks. And I end the segment with a topic on men's health. So I try to pull together all of the things that men who are out there in the village need to be thinking about and need to be doing a better job at taking care of so that they can live a long and healthy life and being able to take care of their families. It's important that we start to do a better job at building legacy wealth and taking care of our families. And so I end the Sugar Buster series with a men's health segment that talks about all the topics that men need to know. So these shows are up on my website on YouTube. It's called Healing Our Village Official. And so these are available for you to watch anytime that you want. Share it with the men in your life that you want to keep healthy. And so I encourage us to do that, especially during this holiday season. We're about to start. Thanksgiving's around the corner, then we go into Christmas, then we go into New Year's, and there are a lot of people who have heart attacks and strokes during this time of year. So I want everyone to be sure to share the information that is on my YouTube channel, Healing Our Village Official, so that we can make sure everybody goes into this holiday season healthy and able to make it through until 2023. That's the goal that I want everyone in the village to do for me. It makes me very happy. So we're going to talk a little bit about all the issues related to men's health. And the reason why we talk about it is because the current state of men's health is not good. You can see a graph here, and this graph looks at all different kinds of men. So Hispanic men, white men, black men, all cases, Asian men, and you can see on the left-hand side of this graph that black men have the highest rates of poor health and death. So men are half as likely to see their doctor. We used to do this whole take your loved one to a doctor day. So we really need to make sure that all our men out there are talking to a healthcare provider and getting a physical exam. It's really important. We also know that men are more likely to be uninsured than women, and that men are dying at higher rates than women for 9 of the top 10 causes of death. So the graph is here. It shows us that. And so we need to make sure that our black men, which is the blue bar, right, are not dying at higher rates than black women and are not dying at higher rates than all the other races that we have around the world. Now, I said they don't go to the doctor. Why don't they go to the doctor? That's the question. Why would you not go to the doctor, even though you know that something's not quite feeling right, but you delay in going to get medical care? Well, it has to do with our upbringing, the way our society plays a part in the way that men think. So men are taught to be big boys. They're taught to be not cry. They're taught to not complain. They're taught to suck it up. All right? And because that is what
society expects from men, men don't therefore want to go to the doctor because they think it's just something that they'll be able to just tough it out, just get through. And that does not work, folks. All right? So you men out there who I'm talking to, whenever you get the first ache or pain anywhere, you need to go see a doctor. Men don't like to miss work. They hate to miss work. In fact, they never call in sick. So at the end of a career where you've been working for the state or the federal government or your long-term job, and you have hours and hours and hours worth of sick leave, that you don't get all of it. So I submit to you, whatever you have on the books for a given year, all right, you need to make sure, especially if you're in lose it or use it, you need to use your sick leave, all right? That's very important, to get your eyes checked and your prostate checked and your blood pressure checked and get to your doctors. And you need to do that. It's very important. Also, men do not necessarily look for jobs that have health insurance. They'll take a job and they don't even care whether they have health insurance or not. That's not good. If you are the head of your family and your significant other and your children are dependent upon you to stay healthy, then you need to have health insurance, and that helps your family get health insurance. It's really important. And then some men decide that they're just going to wait to see if this is just going to pass, if they're going to just start feeling better magically. All right? Most things do not pass. So we need to have men make health their top priority. Now, a lot of times they say they're too busy. A lot of times they say, I don't trust doctors. I don't want to get a prostate exam because it's uncomfortable. I'm afraid they may find something wrong. That's probably, in my experience, the biggest reason. You don't want the doctor to tell you bad news. You don't want no bad news. And so therefore, you're scared to go to the doctor. I encourage you to go early, because even if it is bad news, if you catch it early, then things can be okay. But if you delay and you wait, this can make things even worse. So please, don't be afraid. Medical science is amazing. They have come up with all sorts of cures for things that they didn't have cures for 10, 15, 20 years ago. So get a good doctor, somebody that you trust. If you don't know where to go, call me. I know doctors across the country. So just give Healing Our Village a call at 800-788-0941, and we will get you into a good physician or a good clinic wherever you live. It's very important. Now, we're going to go through sort of the top 5 men's health issues. We're going to talk a little bit about diabetes, about cardiovascular disease, about cancer. We're going to talk a little bit about mental health, and then a little bit about sexual health, which includes erectile dysfunction and HIV/AIDS. So let's start with my favorite topic. I've spent my whole career on diabetes. This is Diabetes Month. November is Diabetes Month. So if you are part of my Facebook chat, if you have my Facebook page up on your notifications, we're posting every day things that you need to know about diabetes. Now, we know that diabetes is the leading cause of heart attacks and strokes, leading cause of kidney disease and amputation, that diabetes cannot be cured, but it can be managed. That when you first start having your blood sugars go up, the first thing to do is reduce the carbohydrates in your diet. So that's your rice, your pasta, your potatoes, your tortillas. All of those are high in starch. So you just can Google, what are my starchy foods? And then try to eat either small amounts of those or eliminate them from your diet. 90% of patients with diabetes have type 2 diabetes. So that's what I usually talk about mostly. And the keys to preventing type 2 diabetes is losing weight down to trying to get as close to your ideal weight as possible, which is super, super hard. Getting more exercise, which is also really hard. They want you to now take 11,000 steps a day. If you've ever tried to take 11,000 steps a day, you know it's not easy. You got to be moving pretty much that whole 8-hour day. And most of us work in jobs where we sit. So you have to be intentional about your exercise. And then as you get older and you start having hip problems and knee problems and back problems, it makes getting that exercise even more difficult. And then again, trying to just think about what you're eating and making sure it's low fat and the right calorie count for you. So women should be somewhere around 1,200 to 1,500 calories a day. Men should be somewhere around 1,800 to 2,000 calories a day. So that means you need to look at the labels of everything you're eating and add up the calories that you're having per day, so that you're not overeating your calories. Because if you eat more than those calories I just mentioned, then that means you got to burn them off by doing more exercise. See, it's very simple. Calories in, calories out. So you can take more calories in if you're burning those calories out. But if you're not burning, then you have to actually watch your calories. Now, we have 37.3 million Americans or so that have diabetes, and 8.5 million do not know that they have it. And what diabetes is the inability of the body to be able to handle those sugars and starches that we're eating. And so the body stops being able to turn everything we eat into energy, into fuel for our body. So people with diabetes spend 2 to 3 times more on medical care, mainly because of this blood sugar going up and causing you to have eye problems and kidney problems and heart problems, all right? So men that have poor blood glucose control also are more prone to erectile dysfunction, and we'll talk about that. So getting your blood pressure under control, getting your blood sugar under control will prevent one of the men's health problems that is very common in this country, which is erectile dysfunction. Now this looks at cardiovascular disease, and we know that African Americans are 2 to 5 times more likely to have heart disease and to die early because of heart disease. So you see hypertension earlier in men, especially African American men, and they die earlier due to cardiovascular disease, whether it be high blood pressure, whether it be heart failure. All of those are increased in African Americans. So we want you to pay attention to your blood pressure. Your blood pressure needs to be low. All right, so I'm actually now on something called remote patient monitoring. So this morning I got up, right as soon as I woke up, before I got out of the bed and got started, and I took my weight, which now goes up to the cloud so I can know what my weight is and I can watch the trend over time, and I took my blood pressure because I want to make sure my blood pressure stays low. So I took it first thing this morning, and it was actually very low, which is good. The lower the better. My blood pressure today was 100/60, which is great, That's a great pressure, right? Normal is 120/80, but what I learned when I went to Africa and I went to Kenya is that if you went to the tribal units out in Kenya, we went to the Maasai tribe, their blood pressures were 90/60. That's why they don't have kidney disease. They don't have eye disease. They don't have all these problems, because their blood pressures are low, low, low. Our blood pressures here in the United States as African Americans are high. And that's because of a number of reasons that we can go through if you watch my Sugar Busters, The Heart of the Matter. Now, let's talk about what to do about cardiovascular disease. I want you to get your blood pressure down. I want you to get your cholesterol down. If you do those 2 things, you won't have heart attack. You'll decrease your chances of heart attacks and strokes. You need to try to prevent getting heart disease. All right, so if you're in your 30s right now, you actually probably do not have heart disease. So you got to get your regular checkups. You got to make sure your weight stays where it needs to be. Your BMI needs to be 27 or less. If you don't know what your body mass index is, what your BMI is, go to Google. Put in your height and your weight. It'll tell you what your BMI is. You need to be at 27, okay, or less. Getting your regular training, which does not necessarily mean only weights. You got to do both the cardiovascular training and the weight training. Limit the amount of alcohol that you're drinking. Certainly get rid of the smoking. You got to stop smoking. And you gotta start figuring out how to reduce the stress in your life. Stress will kill you. Stress will kill you. All right? And so one of the things that I try to do in my life is I try to control my environment. I try to control my work environment. I try to control my personal environment. So I don't let stress around me. And if anybody's bringing me stress, then I stop being around them, because you're not going to stress me out. I'm not going to let you do that. I am in control of that. I am in control of that. So you are in control of your work environment and your personal environment. So I encourage you that if any of those areas are stressing you out, you need to make a life change. You need to figure that out. It's very important, especially men, because men internalize this thing. And then all of a sudden they blow up. So you cannot do that. You gotta not internalize things, and you have to just deal with them directly. Now, smoking. Everybody out there who smokes needs to stop smoking. We know that smoking causes 87% of the lung cancers. All right? Cancers in the lung, cancer in the esophagus, the pharynx, the pancreas, the uterus, the kidney. That's what cigarette smokers get. They get those kinds of cancers. And so stop. It costs a lot of money. It doesn't help you. So you need to stop smoking. It also affects your children. If you're around your kids and you're smoking, we know that 15 million of the children under age 18 are exposed to smoke, either at home or in a car. So now the good news about the youth smoking, actually, this is the first time in 2021 where youth smoking actually dropped to 2.3%. It's an all-time low. So our kids have gotten the message. They need to stop smoking cigarettes. But guess what they're doing? They're vaping. Okay, so that's not good. It's still a foreign substance going into your lungs. Okay, we don't want to do that. All right, now, about 2,500 people we know under the age of 18 at least try a cigarette. About 400 of those people actually turn into smokers. And we know that women smokers who use oral contraceptives, they're at a really high risk of heart attacks and strokes. So that's why women definitely also need to not smoke. Okay, now, why is it that you get hooked to cigarettes? It's because of the chemicals. The chemicals that are in the cigarettes excite the chemicals in your brain that get released when you smoke. So you'll hear smokers talk about, it makes me feel better, right? It makes me feel happier, right? That's because cigarettes affect your dopamine and your norepinephrine. Some people say, I use it to decrease my hunger. It does decrease your hunger. That's because of norepinephrine and serotonin. It says it helps me think clearly. When I need it when I'm during the workday, because it helps me really focus my mental thinking. That is true. That's because of vasopressin and acetylcholine. And people say, oh, it just makes me less tense. It just calms me down. It calms me down. And it does, because of beta endorphin. So there are chemical, scientific, physiologic reasons for why cigarettes make you feel the way you feel. So you're not making it up. It's true. All right? The problem is that it causes other bad effects, other chronic conditions. And so that's why the cigarettes are a problem. Okay? Plus the manufacturers actually make them more unhealthy because they want to get you hooked, because they want you to buy them. And cigarettes cost a whole lot of money now. All right? So it's a very expensive habit. And we know that just this putting something to you, just the whole hand-to-mouth act is a ritual. And the act of inhalation, all of that is part of this process that gets you addicted to smoking the cigarettes. So the other problem with cigarette smoking is that many of you associate it with something else that you like to do, like coffee breaks, or drinking alcohol, or when you go out to party, all right, or driving to work. So you've now associated the cigarette with this thing that you do every day, which makes it hard to stop, because you still have to go to work. You still want to maybe have a glass of wine, but now you got this cigarette that you want to have at the same time. So we got to break those things apart so you're not associating them together. All right, now, quitting is hard. We know that 1/3 of quitters relapse within 24 hours and 2/3 resume in 48 hours. So quitting is not easy. It's much easier now that you have the nicotine patches and the nicotine gums and all of that are available over the counter. You used to have a prescription for those, but now you don't. So it's just more willpower than anything else and changing up the habits that you formed so that you can break those habits. So I know that you can do it because the amount of people who are smoking in this country has decreased, and that's good news. All right, now let's talk about prostate health. Men die of prostate cancer. This is a treatable, if it's detected early, it can be cured. So I want you all to get your regular prostate exams, all right? What it's called is benign prostatic hypertrophy. So it's the enlargement of the prostate gland. So it's a progressive condition. A lot of men start knowing there's something going on because they have to urinate frequently, or they have a decreased urine stream, or they have difficulty or pain upon urination. And it affects men that are over the age of 50. About 50% of men over the age of 50 have some kind of prostate enlargement. And it also affects 90% of the men over 80 years old. Now, we need to get more men diagnosed. Less than 50% of men are diagnosed, less than 20% of men are being treated, and the progression can be very slow, but can be stopped if you catch it early. All right? So it's very important that you go in every year and see your doctor and get a full physical, and a full physical for men includes checking the prostate. Now, there's something called prostatitis, which is infection of the prostate, but it really has nothing to do with most of this benign prostatic hypertrophy. That BPH is what they call it, just abbreviation, and that's seen, as we said, commonly. So, early detection is the key. You're trying to prevent prostate cancer. Prostate cancer is the #1 cancer in men. You need to consult your doctor once you get up in age with these yearly exams at 50 and have safe sex. You want to be sure that you're using condoms unless you're in a committed relationship. Okay, you have to think about all of that because you want to make sure, because all of that is unsafe sex is not a good idea because it causes the infection, the prostatitis, and other issues. Now, let's talk about cancer. Cancer is actually getting better in this country. And actually, it's because of the funding that has been now put into cancer research, mainly because of our current president, whose son died of cancer. And so he, way back when he was still vice president, he helped direct a lot of money toward cancer research. So I want you to know that cancer is getting better, and there's way more research going on than before. In the United States, we estimate that in 2020, we had about 605,000 people died of cancer. According to the American Cancer Society, the lifetime risk of developing cancer is 1 in 2 for men over the course of their lifetime. We already said prostate cancer is the most common. Lung cancer is the most common fatal cancer in men. And the majority of cancer cases happen when you get to that 55 and older. But in African Americans, it happens younger. So when you get to 45 years old, you need to start paying attention. You really do. 40, 45, you need to start paying attention. Because we just have higher rates of death from cancer than our Caucasian counterparts because we don't catch it early and we're not getting ongoing, regular, routine care. Very important for us. All right, now, let's talk about what cancer is. You all heard of a cancer cell, right? You've heard of the cancer cell. It only takes one of them, and then it starts building and growing and creating other cancer cells. Okay, so all of this building blocks happens in our tissues. So we know that the cells of our body replicate all the time. All right, so that's how our body regenerates itself. The problem is if one of those cells turns into a cancer cell, and then it divides and replicates and becomes a tumor. Now, not all tumors are cancer. There are what we call benign cancers that are just a growth of cells that can be easily taken out with surgery, and there's no problem. But there are some tumors that are malignant. And so malignant tumors are cancer, and they can be life-threatening and can be very serious, again, if not caught early. Now, let's get a little more deep dive into prostate cancer. The prostate, you can see in this picture, is shown here, is part of the man's reproductive system. And it is located in front of the rectum, but under the bladder. And a healthy prostate is about the size of a walnut. All right, so that's when you get your prostate exam and the doctor goes in and does the exam, he will feel the prostate. And if it doesn't feel right, if it feels bigger than a walnut, then he knows there's something going on, right? Okay, now, the urethra is the tube where the urine flows through, and it passes through the prostate. So that's why if the prostate gets too big, it starts to decrease your urine flow. So now you understand why a lot of men, that's the first sign that they get, that there may be something going on with their prostate. Now, who's at risk? We already talked about people who are in their 40s, 45. That's when you need to start thinking about it. Family history. If you had prostate cancer in your family, or you have a male in your family that had prostate problems, that's a risk factor. Race. Prostate cancer is more common in African American men than white men. All right? And then your diet. There have been some small studies that have suggested that men who eat a high-fat diet, so a lot of greasy foods and a lot of meat, beef, pork, may have an increased risk of prostate cancer. That's why we really encourage everyone to just try to eat more plant-based, try to eat more fish and chicken, and to try to eat a diet that's rich in fiber and fruits and vegetables. Because those people who eat those kinds of diets tend to have a lower risk of getting cancer. Okay, now, we talked about the symptoms. A need to urinate frequently, pain or burning upon urination, difficulty getting an erection, frequent pain in the lower back or your hips or your thighs. You think you got back pain and it's actually prostate. So that is why when you get any ache or any pain, you need to go to the doctor. It's very important. Now, the doctor is going to do what they call a digital rectal exam. So they insert a lubricated gloved finger into the rectum and they feel for that prostate to make sure that it feels right, it's not lumpy or solid, and that it's small, right? Or there's a blood test you can do called the PSA, and that stands for prostate specific antigen. And so you can do that prostate test, and if that number is high, then it means that there may be a problem with the prostate. Okay, now most doctors like to do both. They do both the rectal exam and they do the blood test at the same time. All right, now one of the things that's interesting is African American men may have a high number and not necessarily have prostate cancer. So that's why it's important that you get that test done and get it evaluated by a doctor who is usually a urologist who can tell you exactly what's going on. Now, colon cancer, rectal cancer. These are part of the digestive system, your colon and your rectum. And the big long tube is your large intestines, all right? Now, we know that all throughout this system, so you got your rectum, you got your colon, you got your large intestine, you got your small intestine, you got your sigmoid colon. All of that is part of that lower system of digestion. The cancers in any one of those areas is a possibility. Now, let's talk about colon cancer. One of the easiest cancers to treat if caught early. 90% of the people with the disease are diagnosed usually after the age of 50, but my husband at 38 died of colon cancer. So it can happen in young men, all right? And usually, a lot of times what they have is these polyps. They have colorectal polyps. And those polyps grow in the inner wall of the colon or the rectum. Now, most of these polyps are benign, but sometimes they can become cancerous. All right, and sometimes if they get aggravated, they can bleed. So if you're having any bleeding from the rectum, that is something that should take you to the doctor immediately. Immediately. A lot of people just chalk it up and say, oh, well, it's no big thing, it's just my polyps. No, it's a big thing. And you need to go and get checked. All right, now, risk factors for colon cancer, family history again. Personal history, maybe you had it before, it was caught and then it came back. We talked about ulcerative colitis and Crohn's disease. Those people are at risk. People with a diet high in fat, we talked about that. Cigarette smoking. If they go back and they look at data over the years, they do these sort of what they call longitudinal studies, and they look at large populations of men over the years. And they then see what kinds of lifestyles those people have and what did they ended up dying of, or what kind of chronic diseases did they get. And so cigarette smoking has been associated as a risk factor for colon cancer, another reason not to smoke. Lung cancer. Of course, we know that the cancers that begin in the lungs are divided into two major types. There's either non-small cell lung cancer or small cell lung cancer. My brother died of lung cancer. He was in his 30s. These things are happening to people who are young. He initially was a smoker, and then he stopped smoking. But he still died of lung cancer. Went for a whole year having coughing and all the symptoms, didn't get to a doctor. By the time he finally got there, it was too late, it had spread. So it's important that, again, any signs of anything, don't just attribute it to, oh, I just got the flu, oh, I just got this. Go and see exactly what's going on. So the non-small cell lung cancer is more common than small cell lung cancer. The small cell lung cancer is very aggressive, grows very quickly, and spreads quickly. So that's why the diagnosis of that is early is critical. So you can stop that thing in its tracks before it spreads. We know we talked about smoking, but also environmental smoke. If you're around a smoker, that means your lungs are being exposed, all right? That's called involuntary or passive smoking. So you do not want to be around a smoker, and you do not want to be inhaling their smoke, because that can be a problem. There are some people who get lung cancer because they work in a workplace that either has radon, which is an odorless, tasteless radioactive gas, or they have asbestos. So there's a lot of factories that still have asbestos in those industries. So shipbuilding, asbestos mining, insulation, brake repair. Who would think? Yeah, all of that can increase you to being able to inhale the asbestos, which then gets in your lungs and can cause problems. Living in a highly polluted environment, so you're breathing in bad air. People who have tuberculosis could increase your chances of developing lung cancer. So that's why if you have TB, it's important to get it treated quickly and keep it under control. And then a personal history. Again, if you've had it before, it can definitely come back. Symptoms: constant chest pain, coughing, and it doesn't go away, shortness of breath, wheezing, repeated problems with pneumonia or bronchitis. All of that can be signs of lung cancer. All of a sudden, you don't have any appetite. All of a sudden, you're starting to lose weight and you're not trying. Being just super tired all the time. All of these are the symptoms of lung cancer. So we're going to take a short break right here, and then we're going to come back and get up, get yourself a glass of water, walk in place, and we'll be right back.
Hello, I'm Dr. Lenore Coleman, president and founder of Healing Our Village. Did you know 88 million people in the United States have prediabetes, and that number keeps growing? Did you know that more than 2 in 3 adults in the United States are either overweight or obese? Healing Our Village is excited to introduce Step Up 90, weight loss and diabetes prevention program all in one. Finally, There is a guided mobile app that will help you lose 5 to 7% of your body weight and help you get your 150 minutes of exercise in every week. All of this is available on your cell phone, notepad, or computer. To install Step Up 90, all you have to do is go to www.stepup90 from your phone or computer and hit the install button. Once the icon is added to your home screen, you can create a unique login and password or use your Facebook or Google login credentials. Do you have prediabetes? Does diabetes run in your family? Well, once you log in to Step Up 90, you can take the diabetes risk test. If you score more than 5, you may be at risk of developing type 2 diabetes. Step Up 90 features the CDC-approved Prevent T2 program, along with their food log, fitness log, and action plan. All materials can be printed or downloaded for easy use. Our monthly calendar provides our virtual class schedule with a reminder 30 minutes before the class to help you remember. Are you looking for easy to understand lifestyle videos, healthy recipes, exercise classes, nutritional support groups, or a cooking demonstration? All of this is available with our premium package. The most unique feature of Step Up 90 is your ability to chat with your lifestyle coach, a clinical pharmacist, or a registered dietitian. These experts will have weekly office hours. They are there to help you achieve your lifestyle goals and manage your medications. Sign up today for Step Up 90. We have our basic package starting at $5.99, featuring our weekly Zoom classes, and our premium package at $19.99. Step Up 90, it is time for you to step up.
Hi, welcome back. This is our Sugar Busters series number 7, where I talk about men's health issues. I'm Dr. Lenore Coleman, president and founder of Healing Our Village. All of these videos can be found on Healing Our Village Official. That is up on YouTube. So all of the videos that I've done over the last couple of years are posted up there, and we refresh the videos on a regular basis so that we have the newest content that I'm delivering. So we're talking about men's health, we're talking about cancer in men, and so now we're going to talk a little bit about testicular cancer. It's the most common form of cancer in men ages 15 to 39. So this happens in younger men, all right? The risk factors include an undescended testicle, family history. White men are more likely to get testicular cancer than African Americans or Latinos or Asians. And we know that testicular cancer is less common among older and middle-aged men. Erectile dysfunction. About 30 million American men experience erectile dysfunction. It can be caused because you have your blood sugars out of control with diabetes, or your blood pressure is out of control with hypertension. It can be caused by some medications, and cannabis may actually reduce sexual function. There's conflicting studies on this, but it's definitely been looked at and researched. We know that sexually transmitted diseases are common in men still. There are still men out there getting gonorrhea, syphilis, chlamydia. Over 20 million new cases are diagnosed every year. All right, that's when I talked about safe sex. That's what I'm talking about. All right, though, you need to be sure that you're not having these sexually transmitted diseases that you're passing on to other people. We know that the more sexual partners you have, the more your chance of getting an STD. And we also know that HIV/AIDS is a sexual health condition. It is a sexually transmitted disease. So we're going to talk a little bit more about HIV later on in the program. So let's talk, in fact, right now. So let's talk about HIV/AIDS. AIDS is acquired immunodeficiency syndrome. That's what it stands for. And it's a whole collection of conditions and symptoms due to the HIV virus. All right, so it's called the human immunodeficiency virus, HIV. Some people can be positive for the virus but not have AIDS. But some people have AIDS where they have this collection of conditions and symptoms that ultimately can lead to their death. Now, we know that about 40 million people or so are currently living with HIV infection, and 25 million have died from this disease. In the United States, about 1 million people are currently affected. Because of the research that's been done in this area, I mean a huge, huge, huge amount of research, there are now amazing drugs that were not available 10, 15, 20 years ago, which have gotten it to the point that even if you have the virus, you can get the viral load so low, so undetected, that it can change your life so that you don't have to worry about it so much. So the medications are amazing. They have put these drugs into multiple combinations of drugs. There's injections, there's orals, there's all sorts of things that are out there. And so the amazing things that medical science has been able to do in my lifetime as being a healthcare professional, this is one area. Cancer and HIV/AIDS is an area where medical research has been phenomenal. We know that the virus is something that belongs to the lentivirus of families. It's a retrovirus, right? And these family of viruses are known to be what they call latent. So they start off very low levels and they build up slowly, right? But once you get to a certain point, you will have that virus circulating in the blood. That's what viremia means. And so it can affect the nervous system and it can affect the immune response of your body. So it decreases your immune system. In terms of symptoms, they're kind of, sort of nebulous. Flu-like illness, maybe with a fever, a sore throat, a headache. Maybe your lymph nodes will become enlarged. And sometimes these symptoms can disappear. So like you just don't even know that there's anything going wrong. So if you're having sex with multiple partners, if you're not having safe sex, which means you're using condoms, if you're not doing that, then you need to just, on a regular basis, get an HIV test so that you know that you aren't HIV positive. Who should test? Again, people who are using injected drugs, so people who are injecting drugs, sharing needles, sharing syringes, people who are having unprotected vaginal or anal or oral sex. So that's men having sex with men is where you see it, but men having sex with women, they can then give them the infection as well. If you've exchanged sex for money or drugs, the people who are living in that kind of culture, right? Those folks have an increased chance of getting HIV, AIDS, and if you've been diagnosed with either hepatitis or tuberculosis, or again, those sexually transmitted diseases, those people end up being in that category of people who are at high risk. If you've received a blood transfusion, if you've had sex with somebody with a history of risk-taking behavior, or if you plan to become pregnant, be sure that you get your HIV test as part of that planning in pregnancy, because you don't want to become pregnant if you are HIV positive, because that leads to a whole other set of conditions and situations where you need to be under the care of a doctor to get you through that process. There is an antibody test that you can take, and because when the HIV enters the body, it begins to attack certain white blood cells called T4 cells, right, or helper cells, and your doctor may also call them CD4 cells, and these are important to the immune system. The immune system that produces these antibodies help the body fight off infection, including the HIV viral infection. Therefore, in the presence of these antibodies, the HIV result it will give you an HIV, will show that you potentially have an HIV infection, all right? So the HIV test, the antibody test, look for the presence of the HIV antibodies. They don't necessarily test for the virus. They test for the antibodies to the virus, okay? So there are some at-home tests. There are some ways that you can do the test and send it out and get the results back. But I really encourage people to go to their doctor. The immune system that produces these antibodies, are, as I said, are used to fight off all infections. So we don't want that HIV to happen, because remember when we had COVID, those people that were HIV positive had decreased immune systems and were more susceptible to getting the COVID infection. So because of that decrease in the immune system, if you have HIV, that causes you to have other problems as well. There is certain tests called the ELISA, ELISA, and it usually is done twice. Also, there's the Western blot test, which was one of the first tests used to confirm if you were HIV positive. There are rapid tests that are available. Some of them are using saliva, the OraSure, right? So you can be able to use that. So there are a number of tests out there. Again, the research around treatment, the research around testing has been phenomenal in this area. So there's no reason for anyone to be out there and not know what's happening in terms of their HIV status. Some of the tests do not necessarily involve drawing blood. You can do urine or oral fluid as HIV tests. So again, the urine testing is available, and then that OraSure is available. So let's talk a little bit about mental health. We're going into the holidays. This is a really tough time. This is when the risk of depression and suicides go up dramatically during these next few weeks through the new year. A lot of people have lost loved ones. A lot of people lost people due to COVID. A lot of people have gone through divorces. They've gone through other kinds of losses in their life. And that leads to a lot of anxiety, a lot of stress, and a lot of depression. So when you talk about mental health, you're talking about mental illness. It's a whole collection of diagnosed mental disorders. We know that the factors that affect your mental health include that loss of employment, even the birth of a child. You think that should make you happy, but all of a sudden now you're waking up every 2 hours. All right, so that is stressful. Moving to a new job, moving to a new home, natural disasters. Those people down in Florida right now who just got done getting hit by another hurricane, where they had more water coming in, more flooding, more damage, that is stressful. Okay, and that can lead you during this period of time, these holidays, to really get into a depressive state because you've lost all of your belongings, has now been washed away. And that is so traumatic. So you have to be aware of your mental health, your mental state, and know if when you start sort of sinking into those areas of depression, you got to figure a way to pull yourself back out. We know that depression affects nearly 40 million Americans. It's underdiagnosed. We know that men are 4 times more likely to commit suicide than women. 4 times. All right? And so women and men get depressed at the same rate, but men are just not sort of put together in a way that they're able to deal with it as well as women. Okay? Without treatment, this depression can last for weeks, months, and years. So if you have clinical depression, you have to go see a doctor. So you can get therapy, but you can also get medications to be able to take at least for a short period of time to help you get through whatever's going on right now in your life, right? Because depression is one of the leading causes of disability in the United States. So let's talk about stress. Stress is ubiquitous. You don't know it. It's hard to put your finger on it, right? To pinpoint it. But you just feel anxious. You feel stress. Now, sometimes stress can be positive. Some people like stressful jobs. It makes them thrive. There are people like that, right? So for those people, a little stress is good for them. But by and large, stress is negative because it unfortunately affects the chemicals in your body to make your blood pressure go up and make your blood sugar go up. And so if you have diabetes or hypertension, stress is bad. Stress is bad. So again, focusing on what's happening with you personally is what you got to do. Because everybody has the ability to alter their stress level. You're in control of this. You don't have to be stressed. All right, so stress is basically a physical or mental response to either a challenging or threatening situation brought on by a stressor. So when we're stressed, we get these chemicals, like I said, that get released. And those chemicals cause the stress to happen, but also affects the various systems in your body. All right? So there's two kinds of stress. There's chronic stress and there's acute stress. Acute stress is the stress response to an immediate threatening situation. But chronic stress is what we're talking about. That's caused by family relationships, by chronic illnesses, by financial instability, by racism and discrimination. For African Americans, big, huge reason for stress. And you don't even sometimes realize that stuff's going on and that it's affecting you, but it is. All right? So if you're on a job and there's a whole lot of people there that are, are racist, are not understanding, are putting these pressures on you, you need to get yourself another job. You need to get yourself another job. Right now, the unemployment rate's the lowest it's ever been. They say in this country now we got 2 jobs for every 1 person. Now, you might not be trained to get those jobs. So that's on you. You need to get yourself together to get trained to get another job, another higher paying job, a job that you like. It's very important. I'm gonna deviate here just for a minute. So I had a conversation with my kids, and they're not kids, they're grown adults. I had a conversation with them last week, and let me tell you what they said to me, which is really interesting. I don't look at a job as fun. I don't see any pleasure in my job. You like your job. So you have spent your whole life doing something that you love to do. You get up every day looking forward to it. I don't look at it that way. A job is work, and I don't like to work. Okay. Let me tell you something about that. And the reason I'm talking about this is right now in the African American community, but in communities of color all across this country, this is a real problem for our Gen Z and Gen Y, all of those folks that are 18 to 35. It's a problem. And let me tell you why it's a problem. Because you got to work to live. Unless you're going to win the lotto, you got to pay your rent, you got to pay your car note, you got to put gas in the car, you got to put food in your refrigerator, you got to turn your lights on. You got to work to live. All right, so if you hate what you have to do 40 hours a week, and it takes 40 for you to hit them bills, and you know it does. If you every day get up, get dressed, get in your car, and you are hating the fact that you got to go to this place, and you have to do that every day for the next 30 years, you got trouble. You got trouble. So I submit to you that the philosophy that you should not get joy out of what you get paid to do is a flawed philosophy. That's a flawed philosophy. So you need to correct that, folks. That's not working because I'm talking about stress. And that means that for the next 30 years, every day that you go to this job that you hate, you're going to be stressed. And that's not the way to live life. So we got to change our concept of what we're doing with the hours of this life that we're living, because we only got so many hours in this life. And so you may need to make every single one of them as happy as possible, as fulfilled as possible, as purposeful as possible. That's you. That's on you. So I can't feel sorry for you if you're stressed and you're depressed, because you're not doing what you need to do to change that, because it's in your control. So when you think about stress, you're talking about stresses to your mind, stresses to your body, stressors to your emotions, and stressors to your behavior. All right, so this is a really good slide. Go again, all of these slides and all of these talks are up on my website, Healing Our Village Official. This is a slide you need to spend some time with because it basically talks about, so if you're talking about the stress of the mind, let's just start there. That's worrying. That's all of this kind of muddled thinking, impaired judgment. All right, doing things that put you at risk, doing things which make you have bad things happen, not thinking ahead, not trying to prevent bad things from happening. All right? We laughed at our parents and our grandparents with all of their old sayings about, a pound of prevention is worth a pound of worth a pound of cure. Pound of prevention is worth a pound of cure. So if I prevent bad things from happening because I think ahead, then I don't have to try to fix it at the last minute. Yes. All right? I used to tell people all the time, and I still do, lack of planning on your part does not constitute an emergency on my part. You need to plan. So you have to get your judgment so that it's not impaired. Nightmares, negativity, making hasty decisions, all of that create stress. All right, let's talk about behaviors. Being accident prone. You got things in your household that you know are an accident waiting to happen. Fix it. You got a step that's broken, fix it. You need a shower mat in your shower because you're slippery, get a shower mat. If you know your car needs a tune-up, if you know your car needs new tires, get the tires. All of these things where accidents happen, but when you then look at why the accident happened, yesterday, I avoided an accident by seconds. This guy was coming across the light heading straight for me. He must have been going 100 miles an hour. I had to swerve to get out of his way. It was going to be a head-on collision if I hadn't been paying attention and swerved at the right second. Guess what? If I had been looking at my phone texting, oh yeah, I would have missed that. Oh yeah, no, that wouldn't have been done. I wouldn't be here today talking to you. So this idea of not being accident prone is important, all right? Loss of appetite, loss of sex drive, drinking more than you should, having insomnia, restlessness, smoking more than you should. All of these are behaviors that you can change. All right, emotions, being irritable, depressed, having apathy, all right? Not seeing any joy in your life. Losing confidence in your ability to be amazing. You're amazing, but you've lost confidence that you're amazing, and so therefore, that's a problem. Those are emotions. Those are things that you can control. Depression, sadness. Sadness. I was talking to somebody a couple of days ago. They just had a breakup with the guy that they were dating. And so just thinking about that makes them sad, makes them want to cry. And what I said to them is that you get to control how you think about that situation. So I've just had a breakup. I've lost someone that I was in love with. They left me. I didn't leave them. And that makes me sad because now I'm lonely. Well, doesn't have to. You could have a whole different take on that thing. You could say, man, am I glad they gone? Because if I go back and I think about what that looked like every day, I wasn't happy a lot of the time while they was there. Okay? I wasn't happy a whole bunch of the time that they were there. So now they're gone. I need to be celebrating. It's party time. It's time to go out and call up people I haven't talked to in a long time and say, hey, what y'all doing? Hey, let me come by. Let's go out. Let's do something. Let's have some fun. Yeah, because you now have, this is an anchor around your neck that now has been taken off. You can look at it that way. You get the choice of how you look at your life and how that then creates the emotion that you have about that. So I'm always been, my entire life, since I was a little girl, glass half full. I'm always a glass half full kind of person. I'm always trying to find the good in the bad. I have friends of mine who have told me that I could find a good use for peach pits and lemon seeds. And they're right. I figure out something good to do with some peach pits and lemon seeds because that's the way I live my life. And I don't let anyone come in and try to mess with that. Now, do I have problems? Sure I do. Do I have people that try to mess up my life all the time? Yes, I do. Yes, I do. But they don't come in and take residence in my head or in my heart. I don't let them they don't set up shop there. They can maybe visit for a minute, but they got to go, okay? Emotions. And then your body. Your body tells you when there's a problem. You have headaches. You get a bunch of infections that you don't usually get. All of a sudden, your neck muscles and all your back muscles are taut, right? You're tired. You're having a hard time even getting out there doing the things you used to do because of shortness of breath. All of these are physical manifestations of stress. So I want you all to go back, look at this slide. This is an important slide. And then start thinking about every single one of those categories in your life. Write it down on a piece of paper so that you can figure out how you're going to start checking off these boxes to get rid of the stuff in your life that's causing you to be stressed. Because it also goes hand in hand with anxiety. Now, there are people who have panic attacks. They actually have a panic disorder, or they have obsessive compulsive disorder. So there are clinical terms for these states of anxiety. There are men who are women in the military who have post-traumatic stress disorder. Yesterday was Veterans Day. All right, so there are people who are suffering with PTSD. You can't get over that by yourself. You need to get into a group. You need to get therapy because it is very difficult to deal with these kinds of anxieties and trauma by yourself. Let me tell you what I'm concerned about. I'm concerned about the children ages 10 through 18 who are being bullied, who are going through all sorts of life changes during that time period, and they're not equipped to handle the stress and anxiety that goes along with that. Their parents are MIA. Nobody's paying attention. The teachers barely are paying attention because there's too many kids in the class. All right, we just went through 2 years of insanity with schools, doing online teaching and in-class teaching, and have to wear masks and all sorts of insanity. Our kids have been traumatized. Some of them have lost parents, grandparents, family members, and we're not doing anything to address that for our kids. So the suicide rate for kids is now sky high. Sky high. And when it happens, the parent says, I didn't know. I had no idea that they were going through this. So please, everybody, slow down if you got kids. Let's get back to family dinners. Let's get people around the table. Let's talk about how'd your day go? What was the best part of your day? What was the worst part of your day? So you can chime in and help these kids because they're struggling. They're in a state of anxiety. Hepatitis C, just a really quick thing. We're talking about men's health. And so I want to mention that because there are quite a few people out there that are positive for hepatitis C. It's a test you can get done in your doctor's office if you're feeling super tender, fatigued, if you have a tenderness in your abdomen. If you're at the point of jaundice, you've already got the liver problems from hepatitis C. So hepatitis C basically affects the liver. That's what it is. It's a chronic condition. And it's very common in people who have been in prison or who drink excessively. So another test that one needs to get routinely done if you fall in that category, when you go to get your annual checkup from the doctor. So again, an ounce of prevention is worth a pound of cure. So get an annual health exam every year. If you're a man, you're getting your PSAs done, you're getting your prostate exam done, you're getting checked for diabetes, you're making sure that blood pressure is under good control. You've got to make prevention a priority, all right? It's also a family affair. So everyone in the family needs to keep track of their relatives, because sometimes you can see things going on that they can't see. So listen, love starts at home. And so you need to be sure that you're helping your family. And if you've got people in your family that you can see are going down a not so good road, you got to get in there and try to help them as much as you can. Sometimes they won't let you, but if they will let you, you can be a role model for your family and help your family to get in to see their doctors, to get the kind of good care that they need. And listen, you can join Village Club at Healing Our Village, and we can help as well. And we're going to talk about that later on in the show. This is websites that are out here for men. Again, I said these slides are up on the website. Just go there, take a look at HOV, Healing Our Village Official on YouTube. All right, go to HOV Health, and all of the icons for our social media is there. We're sending out daily recipes, and we're daily health tips for free. All you got to do is join my Facebook or my Instagram page. So I encourage you to do that. Let us help you here at Healing Our Village. This is the end of the program, but again, I want to thank you. This is segment 7, Men's Health, of our Sugar Buster series that we do around diabetes and what you need to know. So thanks again for tuning in. I want you all to spread the word. I need you to share and subscribe on my Facebook page, on my website, so that we can get you into our email list, so we can send out emails when we're having events, when we're having health screenings. So we want you to definitely go to HOV Health or to my YouTube channel, and so you'll be able to see these things. We have something new called Step Up 90. We're about to do a weight loss program. It's an app that you can actually get with a monthly subscription and be able to have your own personal health coach. This is someone that be at your beck and call. You can chat with them. You can attend our weekly Zoom calls that we have. We have exercise classes and nutritionists that you can talk to. So we would encourage you to learn more about Step Up 90 by calling our 800 number, 800-788-0941. I talked to you about your blood sugar. I talked to you about your blood pressure. We have blood pressure cuffs. We have blood glucose machines. You can purchase our low-cost machines so you can use them at home. Here in Jonesboro, we do something called Wellness Wednesdays. I'm right here on Main Street in Jonesboro, Georgia. Come on by. We'll take your blood sugar. We'll take your blood pressure. We'll make sure that we get you to know about all of our programs that are available for you. So every Wednesday, 11 to 3, we're doing Wellness Wednesdays, and we would love you to come on by and be able to participate in our program. Here's our information. We're at 177 North Main Street in Jonesboro. There's our 800 number. Again, our websites are hovhealth.com. If you'd like to contribute to our efforts, we have a nonprofit called Total Lifestyle Change. We would love you to donate today. It's up there and ready for you to go. $5 would go a long way to helping me heal the village. And as I mentioned, Village Club is right there at the villageclub-global.com, and you can go right up there and subscribe or go to the HOV site and be able to get there as well. And then remember, Sugar Busters every Saturday, 12 to 1. Encourage everybody out there that you know to tune in and to spread the word so that we can get more people to live and not die. Again, thank you very much. This is Dr. Coleman, and have a great day. Hello, I'm Dr. Lenore Coleman, President and founder of Healing Our Village. Did you know 88 million people in the United States have prediabetes, and that number keeps growing? Did you know that more than 2 in 3 adults in the United States are either overweight or obese? Healing Our Village is excited to introduce Step Up 90, weight loss and diabetes prevention program, all in one. Finally, there is a guided mobile app that will help you lose 5 to 7% of your body weight, and
and help you get your 150 minutes of exercise in every week. All of this is available on your cell phone, notepad, or computer. To install Step Up 90, all you have to do is go to www.stepup90 from your phone or computer and hit the install button. Once the icon is added to your home screen, you can create a unique login and password or use your Facebook or Google login credentials. Do you have prediabetes? Does diabetes run in your family? Well, once you log in to Step Up 90, you can take the diabetes risk test. If you score more than 5, you may be at risk of developing type 2 diabetes. Step Up 90 features the CDC-approved Prevent T2 program, along with their food log, fitness log, and action plan. All materials can be printed or downloaded for easy use. Our monthly calendar provides our virtual class schedule with a reminder 30 minutes before the class to help you remember. Are you looking for easy to understand lifestyle videos, healthy recipes, exercise classes, nutritional support groups, or a cooking demonstration? All of this is available with our premium package. The most unique feature of Step Up 90 is your ability to chat with your lifestyle coach, a clinical pharmacist, or a registered dietitian. These experts will have weekly office hours. They are there to help you achieve your lifestyle goals and manage your medications. Sign up today for Step Up 90. We have our basic package starting at $5.99, featuring our weekly Zoom classes, and our premium package at $19.99. Step Up 90, it is time for you to step up.